Hello, I'm Guidotti, and I'm so pleased to be with you for your conference on clean energy and health. This is a subject that's fascinated me throughout my career, and I'm delighted to share some thoughts with you. Here we go. First, let me tell you a little bit about myself and why I'm here talking at you. I am a recovering academic. I retired as a professor of occupational and environmental medicine and of public health, most recently from the George Washington University, but most of my career was at the University of Alberta, which is a center for energy research and technology. My career has straddled public health and medicine, and I was one of the co-founders of the Canadian Association of Physicians for the Environment, an organization of which I'm very proud. In 2015, I wrote this book, Health and Sustainability, and many of the things that I'm going to say are elaborated upon in the book, and it contains references. Now, what were those funny initials on the title slide? Well, they stand for Fellow at the Energy Institute, which is an organization based in the United Kingdom that deals with energy technology and issues. Now, why is clean energy a problem for health? It's obviously a problem for technology and economics, but why health? Well, energy choices that we make shape the world we live in. They're important determinants of the health risks that we take. Energy choices create these health risks through the fuels that we choose, the distribution system, our consumption of energy, and the equity involved in access to energy, and how that energy is used. Energy choices that we make limit our future options and our imagination of what we can do as a society. Energy choices in facilities on the local level, good example is fracking, are locally unwanted land uses, and physicians are very often involved in assessing the local health impact. The healthcare system is a prodigious user of energy, and we'll talk later about how we are part of the problem. Climate change involves bad energy decisions, and it, of course, is the single greatest problem that we face and probably will ever face in terms of health. Pollution and contamination are the most obvious areas in which energy relates to health. Ambient air quality is very much affected by our choice of fuels for road traffic, for transporting goods, and ground level pollution effects, as we know, can cause death, can cause cardiovascular disease, are much more potent than we realized at first as a determinant of health, particularly fine particulate air pollution and ozone, which promote inflammation and which have effects blunting the immune response. This is a particular concern when we're talking about infectious disease such as COVID-19, and this is an area that we're only just beginning to learn about. There's a big reaction or big interaction with temperature as well. So the same pollution sources that emit ground level pollution are also emitting carbon dioxide as well as many other sources. And the two together, when we get heat waves with ground level air pollution, are deadly. We're going to be seeing many more incidents of combined heat waves and ground level air pollution events occurring really in the immediate future. It's not going to take long at all for this to be an obvious health and very dangerous health trend. Energy facilities, I've already mentioned, are often have adverse local effects on the community and are not appreciated by the local community. We'll talk a little bit about occupational health issues and, of course, underlying all of this, and of the greatest concern of all, is climate change. Now, we've been through energy transitions before and problems of pollution. Before we became dependent on the automobile and on fuel for vehicular transport, we faced an enormous pollution problem. In major cities like Philadelphia and London and New York, there was a really nasty problem, and that was the accumulation of manure and of horse carcasses in the streets. There were mountains of this waste. By the end of the 19th century, it was perceived as being a horrendous urban problem and an insurmountable problem, a refractory problem, because of society's dependence on the horse. Well, once the automobile was invented and we switched to gasoline rather than muscle energy, much of this went away, and it went away very quickly over a period of a few years. It was one of the reasons why the automobile was adopted so quickly. However, we traded one problem for another. We sowed the seeds for a problem later in the century that would relate to our dependence on oil. We had low oil prices through most of the 20th century. And because of that, there was little incentive to be efficient in the way that we structured industry, certainly less in with cheap gasoline in where we built our highways and our road system and designed our cities. We preferred lower density because we could have it, because the road system and the internal combustion engine made it possible. Had we had higher oil prices, our cities would look a lot more like European cities. Instead, we bought externalities. Now, externalities is a term used by economists for all the costs that are not paid for by people who benefit from some economic activity. These are the costs that are put on other people. They're put on other people in the form of pollution, in the form of health risk, in the form of energy risk with, for example, road accidents, social fragmentation when communities are split and cut off from others by highways and roads, inequality of access because mass transit is underdeveloped, and ongoing problems with dependence on oil supply and energy insecurity. The new energy regime and the transportation policies that flowed from it had a direct effect on land use. Because the energy regime favored individual vehicles, it had an influence on the built environment. The built environment, in turn, led to a series of secondary effects. For example, many of our communities became unwalkable. It became impractical to take your exercise by hiking in the nearby woods. It became impractical to walk to work. It became impractical for children to walk to school in many cases. This, in turn, has implications for fitness, has implications for childhood obesity rates, and certainly had implications in terms of social access and integration of communities. This, in turn, had a number of social consequences. You can see how cut off the various communities are on the left from one another, and how difficult it is to access, for example, the shopping center on foot. It also fragmented what remained of the natural environment, created barriers between communities. It made it easier to redline communities, to impose racial discrimination based on access to financing and mortgages. This in turn played a role in housing disparities, housing quality varying dramatically from one neighborhood to another, and local zoning impact. We are currently in the midst of an energy transition, and this transition is toward decentralization. It's toward electrification, so that energy generated in one place can easily be used in another. And one of the interesting features of this transition is that we've moved from fossil fuels to cleaner fossil fuels to sustainable sources of energy. Shale gas, which is very problematical, I don't mean to minimize that, in local communities, actually served as a bridging fuel that took us from dirty coal and expensive conventional gas, took us through a period when sustainable energy sources were maturing and were becoming economically competitive. Now, I don't think the shale gas is needed now because that transition is largely completed. But during that critical period, it allowed us to get from one end of the bridge to the other end of the bridge. And now we need to take advantage of that. Fossil fuels are going to be with us for quite some time because they are energy dense and they're very convenient, and because they are abundant and low cost. Unfortunately, China especially is heavily dependent on fossil fuels and becoming more so with its aggressive building of power stations. Paradoxically, China is also the world's leading consumer of sustainable energy. They're just the world's leading consumer of energy wherever they can find it. But unfortunately, they're locking themselves in to horrendous pollution problems that are baked into their system. And they're locking us into continued problems with the greenhouse gas emissions that are bad enough in terms of what we're doing to ourselves. Having an economy the size of China continuing this problem as opposed to effectively being part of the solution is terrible for the world. The United States is not a leader in this energy transition. Europe is the leader in this, and we need to examine our policies and up our game when it comes to the energy transition. We had all expected, I think, that climate change was going to be a major driver that would push people and push the economy toward cleaner energy. But climate change has not provoked or sustained the change that we thought it would. I think that one reason is that climate change is so overwhelming and the consequences are so dire that people can't deal with it. They tend to shut down and go into denial rather than take constructive action. Change is not easy. Now, we pretty much know what to do to achieve a clean energy regime and a green economy. It's really not rocket science or rocket surgery, as we might say in medicine. The basic steps are quite clear, and I'll let you read this yourself rather than go through it line by line. We in healthcare are a big part of the problem, actually. Healthcare consumes a lot of energy and a disproportionate share compared to other sectors in our society. Our hospitals, our clinics, the provision of healthcare to our patients all add up to a substantial consumption of energy and greenhouse gas emissions. We need to back healthy hospitals and other movements and healthcare without harm in order to do the best we can within our sector, because we really are a bad actor when it comes to energy. Occupational health is one really bright spot. Many fossil fuels, particularly coal, have a lot of intrinsic hazards, and occupational health is an ongoing issue in these technologies. By comparison, green energy technologies are not free from hazards, but the hazards are more familiar, they're relatively easily managed, and they're familiar to us. A colleague of mine and I did a study in 2012 that looked at this problem for the World Health Organization and concluded that the single most obvious and prevalent problem of transition to safe and green energy is falls from heights. In other words, wind turbines, installing solar panels on tops of houses. It was that simple. Unusual chemical exposures are largely concentrated in a few energy industries, mainly photovoltaic solar panels. We're still in square one when it comes to figuring out how we're going to deal with the recycling of these panels as they reach the end of their life cycle over the next 10 and 20 years. We don't do that very well, and we need to plan for it. Hydrogen technology doesn't seem to be winning the day, and it's basically a problem of explosion, hazard, and safety. Nuclear is so complicated, it's a whole different discussion, and we would be here for a week if we started tackling that issue. The bottom line is that we have potential for net gain in occupational health with the transition to safe energy. That's a very good thing, and the public expects it. The public thinks of sustainability as including enhancing health. They expect higher standards from sustainable energy technologies. One example of how they reacted and the disappointment that can be produced was experienced by Tesla about a year ago. Tesla, if you'll recall, had a problem with workplace injuries. It was highly publicized at the time and very embarrassing to the company. Well, those risks didn't arise from the novel technology, innovative though it may have been. It was because Tesla was a new entrant into this particular economic sector. It didn't have the same experience developing a safety culture and changing things on the shop floor. So the newbies, the new employers that come into this sector are going to have to learn and be good corporate citizens. On the plus side, the green economy and clean energy include opportunities for creating many more jobs. When you have centralized energy generation, and when you have large-scale power plants and so forth, these are capital intensive, but they're not labor intensive. So once they're built, they run with really a very small group of employees. Generally speaking, green technologies involve more hands-on people employment. So job creation is a major benefit. Now, we all remember this wonderful cartoon from over a decade ago. And it reminds us when we revisit it sort of with fresh eyes that we can emphasize how bad things are and how much worse they're going to get, or we can emphasize the opportunities, how we can reshape the world in the way we want and have a positive benefit and a world we want to live in. Well, we've actually been there before in health promotion. Those of you who are interested in and have followed preventive medicine and public health will recall that maybe 40 years ago or 30 years ago, we seemed to be hitting a wall in terms of people changing their behavior. People knew about the health risks of cigarette smoking, but they weren't quitting, at least in large numbers. Fitness was not a priority, and all of the measures that traditionally were used in health promotion or health education rather didn't seem to be working, because provision of information and educating people about health just didn't seem to be motivating a change. Well, the fields of preventive medicine and public health adopted a new movement. This movement, which was very heavily backed by the World Health Organization, was called health promotion, and it included many different elements. Two of the elements I want to emphasize are healthy public policy, which is that we should be making decisions on the economy, technology, and society with respect to health, just as much as we make decisions based on the economy and politics. As well, there was a change in the way we looked at motivating health behavior. And the pivot was to address the determinants of health on both the personal basis of how we want to change our own lifestyle to achieve greater health, and the collective basis, how we as a society want to change the structure of our cities, want to change the way we do things to promote healthy behaviors, make healthy choices less expensive than the obvious choice in our consumer behavior, and so forth. And in order to do that, we enlisted behavioral scientists and psychologists and other people who were primarily concerned with motivating human behavior. One of the many lessons, one of the many valuable lessons that came out of the rise of health promotion was that the appreciation that positive and encouraging messages work better than negative messages. We tell people how bad things are, they tend to shut down. Well, I think that this same lesson can be turned on its head. We can invert the problem and start talking about all the wonderful things that can happen if only we would commit to making these changes. We can take the lessons of health promotion and apply it to clean energy and environmental sustainability. In health, we weren't making much progress when we talked about the negatives, when we talked about the risk of death, the risk of disease, the risk of to children. What the public heard was to live in fear. Health promotion turned it on its head. It emphasized the opportunity for wellness, making good things happen, engaging in a healthy lifestyle, feeling better, joining friends and family in positive, fun things like walking together and engaging in fitness activities. It emphasized having fun. I think the same thing is necessary in environmental sustainability. Sorry for the distraction in the background. We are constantly emphasizing the negative, and unfortunately, it is true that the situation is dire. The natural world really is in peril. We're constantly involved in confrontations. We're trying to stop the destruction. But in order to achieve success, we need to change the message to one that's positive, one that provides an opportunity for a better world, to enhance the world that we live in. And people are going to be much more motivated by this positive message, because they will hear, have fun in creating a better world, not live in fear. So in closing, I would say that we can look at this beautiful world as being sick, maybe even dying, and we can be very depressed. And people get a very depressing message out of this. Or we can talk about the beauty of the world, and we can talk about how much better things can be and emphasize the positive. Because although the bad things and the dire prospects are very real, people shut down. people get depressed, people go into denial, and they won't respond. But if we emphasize the positive and create a vision of opportunity, I think we have a chance. And we need that chance because we have to make changes very quickly because we're running out of time, at least with respect to climate change. So thank you very much for listening to me. And thank you very much for inviting me into your very exciting conference. I look forward to hearing more about the deliberations over the next few days, and look forward to meeting you individually, face to face, when circumstances allow. Thank you so much, and stay energized for promoting good health.